All right, this next segment is a reminder to cancer patients and the families of cancer patients. It's important not to delay your treatment during this pandemic, and here's why. During the COVID-19 pandemic, cancer patients are both in fear of contracting the virus and going to medical facilities to get treatment.
The biggest challenge we face around the country for all oncology providers is patients not getting their screening. This leads to delays in diagnosis. I personally have had some patients stop therapy.
Dr. Dustin Boyer and the 21st Century Oncology team go above and beyond to take precautions for their patient safety.
One of the changes we've made, we no longer have patients wait in the waiting room. We have them wait out in their cars. We're given strict instructions if we feel sick at all, not to come to work, to call in and let the staff know as soon as possible. All employees, staff are screened every day with temperatures and questions any loss of taste, smell, if you feel sick. And we actually screen our employees twice a day, once in the morning, once in the afternoon. We do what the CDC has recommended. We try and socially isolate, distance. All our employees wear masks and eye shields when we're close to patients.
According to 21st Century Oncology, the risks associated with delaying cancer care have been reported to outweigh the risk of COVID-19. Patients and families have to remember, untreated cancer grows.
So the NCI just published a pilot study where they estimate there are going to be tens of thousands of excess cancer deaths from patients not getting their screenings and not getting their cancer therapies, delay in diagnosis. So it's crucial, even in this deadly pandemic that we're dealing with, that patients come and get their cancer therapy.
21st Century Oncology is the premier provider of cancer services across multiple modalities and have served our Vegas community for over 20 years.
So we have 3 locations, one in Henderson, one at Sunrise Hospital in the medical office building, and the other in North Las Vegas near Mountain View Hospital on Tenaya. And all our physicians, my colleagues, myself, rotate through all of those facilities, so we're available for our patients.
After spending the majority of his medical career in the U.S. military, once Dr. Boyer retired, he searched for a new home with the same values.
21st Century Oncology, in many ways, is like the Army. They spare no expense to buy the most up-to-date technology. So I've really enjoyed that aspect of working for 21st Century Oncology.
For more information on 21st Century Oncology and their locations, call that number on your screen or just visit 21co.com. We'll be right back.